I'm doing my speech over dissociative identity disorder. I will discuss the history, the symptoms, the DSM-5 category versus the DSM-4 category criteria, the prevalence and incidence, the cause, and the treatments of it. History. Originally, it was called multiple personality disorder. It was discovered in 19th century to the early 20th century by Pierre Genet van der Hart. The dissociation is the splitting of personality from conscious control and memory. There was a study of a girl named Eve in the 1970s to the 1980s. That's when it was changed to dissociative identity disorder from multiple personality disorder. It is most likely diagnosed as schizophrenia because the subject has more than a few alters or alternate personalities. Based on Killstrom's research, the first case studies date back to 1905. It's not widely known because patients don't recognize alters until therapy, where the therapist coax the alter egos out. One study conducted on 100 adults showed an average of 13.3 alternate personalities, which ranged from 1 to 60. The most common alter was a child of age 12 or less. Most alters are of opposite sex of the patient diagnosed. In the 1980s to 1990s, it was discussed with patients and the media, and more patients emerged seeking attention because of the media propaganda. That established difficulty for a diagnostic category for this disease. Richard Clough standardized the treatment by operating the integration of the patient is best approached by individual therapy. This way, the media does not influence the disorder and it's all on the patient and the therapist. Mirsky argues against the existence of dissociative identity disorder when he says the idea of multiple personalities has been seized so enthusiastically by the media and entertainment industries that any cases that appear now are likely to be fraudulent, since the alleged patient is in fact suffering from an idea contracted from the culture. The symptoms are varied and reflect other disorders. It's hard to identify and diagnose. Commonly linked to dissociative amnesia, which is recurrent gaps of everyday events, important personal information, and/or traumatic events that are inconsistent of ordinary forgetting. According to Bedell, patient 006 was a 32-year-old female who had bulimia for 10 years and had a history of physical and sexual abuse. Later on, Bedell got a call saying that another patient wanted to be studied for her bulimic trials. Patient 026 was said to be bulimic for 4 years and no history of abuse. To Bedell's surprise, it was the same patient, 006 and 026, with dissociative identity disorder. This disorder is also linked to smaller hippocampus and amygdala size, which is also linked to amnesia. A study using magnetic resonance showed that the hippocampus was 19.2% smaller and the amygdala was 31.6% smaller compared to healthy brains. The primary personality is personality that's usually in control and doesn't know about the alters. It's usually bubbly, takes its time to think things through. It's not spontaneous, it's more good. While the alters are usually the bad personalities that like to have fun and just do things spontaneously. Carlson says that the primary usually doesn't know about the alters, and the alters usually ridicule the primary personality. It is also said that the primary personality experiences mysterious aches and pains and headaches that are from the alters. There's guidelines to this disorder. 1, 2 or more identities with distinct personalities. 2, personalities take up an unidentified person's behavior. 3, unable to recall important facts that may occur when other personalities are present. And 4, substance abuse or general medical conditions are not to blame for the erratic behavior. With these criteria and the symptoms, patients often are in denial of having this disease. The DSM-5 versus DSM-4. Killstrom says the DSM-5, 2 or more distinct personality states are present, which is its own relatively enduring pattern of perceiving, relating to, and thinking about the environment and self. The DSM-4 has the same criteria, however, it is multiple personality disorder, and it was added in 1994. Prevalence and incidence. Studied around the world to discover validity of a trauma-based event. The culture-specific response. The percent of women is higher in Turkey and Netherlands than the US diagnosed. Culture is different for the names of the symptoms, which makes it harder to identify if it actually is dissociative identity disorder in the other countries. The DSM is usually only used in the USA and Canada, and the ICD, which is the International Classification of Diseases, is used in other countries. This makes it harder to diagnose and have the same different symptoms, so it's cultural based. This also means that culture based could be how someone responds to a traumatic event based on their cultures. The cause. The cause for this disorder is still unknown. However, it is stated that abuse and/or mental and physical stress can cause this disorder. Dissociative mental processes is splitting off from conscious awareness and control of thoughts, feelings, memories, and/or mental components in response to situations that are painful, disturbing, or somehow unacceptable to the person experiencing them. In a few studies, it is shown that the PTSD and the DID brain differences show very few differences in anatomy. And it also is showed that both are caused by chronic stress. Also, animal and people studies show that stress equals smaller size in hippocampus and amygdala, which is a critical role in learning, memory, and stress regulation, which can also cause amnesia. There's limited research, however, that links this to abuse. And there's a wide definition of abuse, which also makes it harder to link it all together. An intergenic disease is inadvertently caused by a physician since they coax personalities out, and some people believe this is the cause of the disease. There are several treatments to it. There's psychotherapy and medications, or a combination of the two. People are often taught to remember the trauma in therapy, to actually take the different personalities and combine them into one united personality. In therapy, they are taught relaxation techniques. Clonidine and propanol is common medications for this disease. Medication is used for depression, anxiety, and panic to control the symptoms of this disorder. Sometimes it is too intense and the patient can think of harming themselves and others, and they will be put in psychiatric hospitalization. However, since this disease is hard to identify and diagnose, it is also hard to administer the correct treatment, so therapy is often advised. DID is a very complex disorder and treatments are very complex. It's a disruption in identity, and they want to combine the different identities into one. Several debates on if this is caused by media, culture, or trauma are still occurring. We need to expand our knowledge to better educate the people on this disease and the patients. The criteria for being diagnosed is different in the DSM versus the ICD, and maybe they should just combine into one to identify this disorder.